Hello, my name is Tunde Ajao, and I'm doing a presentation on effective health. First of all, I would like to start with an apology. This is not the health economics project or evaluation that you specified. Cost effectiveness, or cost utility, or cost benefit analysis in this. So this presentation decision trees either. I hadn't built a model as promised, well as required. The stuff that I'm working on now is regards the health sector and it's with my partners, and they are not so keen on sharing that information. Hence, I can't get you any parameters for a model. But this presentation is there was a regarding AI powered by imaging software, which was done by one Mr. Uban in Daltex. He was working with some of the radiologists he uses entirely an open source um, platform, which makes it relatively cheaper. But I couldn't get his concept about using any of this of his information. So this is more to do with just a presentation of technology in health. All the images provided are from the internet, and the sources are displayed. Um, the sources where I took them from are indicated on the pictures. Um, so let's start. The need for technology as in the NHS has been highlighted by especially by the current secretary of State for Health and Social Care, Matthew Hamlock. He wrote in the Telegraph of dated the 24th of April that the NHS must adopt new technology in order to survive. Um, he mentioned that there was a study by the Taxpayers Alliance which suggests about 1/10 of the budget should be used for the introduction of automation services across the NHS. Also, the report highlighted the need for AI to analyze even emergency calls or life threatening situations. The reason why he specified is that number one, there's an aging population. There have been cuts to the budgets in social care. Social care acts like, in fact, is like we could see it as a branch of the NHS in that patients are taken care of, especially elder patients that are taken care um, by some of the facilities that social care offers, the social services offers. But since their cutting has been, their budget has been cut, they are no longer able to go to such areas of, and hence is what they call bed blocking or bed locking. Sorry, oh no, sorry, bed blocking. And with this, with a cost of hospitals, per bed, it's around 400 per, per day. Although NICE said it's 222 pounds. But that report is about 4 years old. Also, there's staff shortages, and also, people are not helping themselves by certain lifestyles factors like drinking too much alcohol, poor diets, and poor appetite, diet, yeah, poor diet, not eating, and also exercise. And there's also an increase in obese children, and that trend, it looks like it's going to continue. So over the years, the cost of the NHS has been on the rise. Um, as you can see from the budget, it's been just increasing in real terms. Um, Also, a larger proportion of the public spending goes on health. So instead of it going to social care now, it's now going directly to being spent on health. And if you look in the 1950s, it was about 10% or 11%. Now is about one third, 30%. And we are also missing various targets. As you can see over the years, we've been missing. They've been set, but we haven't just been keeping the targets. When you look at it, there are various factors which are responsible for the NHS not meeting their targets. The UK population is aging, as previously said, and as you can see, this is the predicted increase in the average population. As you can see over is going to increase, and although it varies from region to region, life expectancy has been so we've been like we've been successful in treating diseases. We've been living longer, but because of that, since elderly people, or the older you are, your problems are more complex, and hence they will cost much more money. So although there's been an increase, yes, also life expectancy, as you can see, is going to be more people are going to be as a proportion of the population. And care for the elderly is even as indicated is because they have more complex problems. You can see that those below 30 years old or 30 years, how much it's costing the NHS. Those 65 years old, how much it's costing the NHS. These are relative figures, anyway, not absolute. And also the increase on health spending has slowed down. There's been usually it's 4% increase, but or more. But as you can see, due to the current government and coalition government and even the conservative government, they have not been so keen on increasing spending on health. Although the NHS has like a 10-year plan, which is supposed to inject more money into by the government from the government, but that is on the line. We also have staff shortages, as I said. These are figures which show the numbers of GPs, which is imposed, but the amount they need, and you can see the disparity in between how much they have and how much. And these are the predicted values which are being shown there. And of course, we do have nurses, problems with the nurses not being enough, and there's a relative shortage of nurses too. That's the previous slide, just quickly pass. So as you can see, the NHS is short-staffed by 35,000. Will be short-staffed, sorry, by 35,000 by the year 2030, and that is a big concern. And there are other issues as well why we do need technology. One is Brexit. The other one is drug-resistant antibiotics, which cost more. The rising cost due to new technology, because when things are new, they will cost more. I've mentioned drug-resistant antibiotics. You have to do further research. Further research is needed, which costs more. And also, if you are doing polypharmacies, that costs more, and so on and so forth. So then also new drugs for new ailments. The new drugs, because the way the pharmacological process goes, they have to make up their money, and it's under license and so on and so forth. And these new drugs do cost more. So in essence, there will be a need, because the costs are so high. There will be a need for technology to kind of offset that. Now, one of the big areas that the NHS is looking into is big data in the healthcare. And one thing about big data, it's uh, it's this systematic extraction of structured and unstructured data, and this is analyzed um, and it reveals patterns and trends. Now we do have supercomputers which use complex algorithm. You know about Moore's law, that its processing powers will be increasing over the years. So, of course, computers will become faster and more reliable now, and hence they'll be able to do more things that we even we even dreamed of. Talking of structured data that is from the normal patient data that has been entered by, but also we have unstructured data like reports, like things like Twitter, Facebook, etc. Now, and even newspaper accounts and all of these, then um, spending patterns, etc., which are not in any particular format, but these can be analyzed and worked upon by complex algorithms which extract specific information, and they're able to make predictions to a large scale. So, but before talking about all these data coming in, well, let's talk about security, because a very important issue that we have to be aware of is the security of of the data, and we always should look at that. We should be able to identify the risk of not only breach or hackings and so on and so forth. We have to determine risk, monitor the risk, and also set in place some risk management policies that will help us to protect the data, which involves various things. We have to be um, GDPR compliant. That means that we have to have a BPO officer that can be um, that is responsible for the data's so things like data breaches, access rights, review protocols, impact assessments will be that responsibility of that particular person. Um, Also, when you're looking at the personal data of somebody, uh, it has to be in a particular format. There has to be um, particular ways in which the data is looked at. Also, when there's data breaches, we have to know there has to be something in place to indicate and to inform who to inform, whom not to inform, etc. So that's about big data, and of course, I've mentioned all the sources that in the healthcare the data comes from, like government agencies. They have feeds. Some are free. Some are. Then we have payer records, smartphones, wearable devices, search engines, and so on and so forth. So that data all comes and it will be analyzed by complex machinery, including artificial intelligence, etc., which analyze the data and allow us to make certain predictions. You've all seen the well, sorry. Those of us who have Moneyball is about um, a coach, Brad Pitt, who is able to analyze data from a variety of matches in baseball. And what he did was that he was able to make very well, um, predictions, and they were able to win at a very cheap price. So, and you've all read, well, sorry, some of us have read Freakonomics. Freakonomics is a book about strange things happening when the researchers go to certain areas and analyze the data. They come up with different kind of results, and what we thought that might be the cause of one thing. In rare aspects, it turns out that it's not actually the cause. It might be an effect, or so on and so forth. A good example is they are linking the fall in crime in New York due to the fact that women started using contraceptive pills. But it's very, very interesting. So you should look into that. Now, what can we get from big data? So it helps us in diagnosis, um, and from that we can identify trends and associations. Prevention also, it helps us to know when things are associated with particular ailments in large scale. We can predict which can cause data diseases. Precision medicine, which it's it's medication tailored to you, or treatment tailored to you. Medical research, that is, then of course, reduction in the adverse medication. Of course, it will lead to cost reduction, and in short, it will help us with a healthy population. Now, with that, if we take a step out and we look at the analysis, what the data tells us, or what the big data tells us, we are able to identify specific trends and association, and it helps us to estimate cost and where we can do savings. So by looking at all these data, we can get a conclusion that what is happening in the real world, so to say. So, for example, things like we are able to deduce that £1 being spent on gym membership, or getting people healthy, as return of investment, is worth £23 in quality of life and reduce NHS use. Also, if you housing intervention, to £1 spent there is equivalent to £70 spent on in the NHS. So, in essence, this gives us a framework or an idea of how savings for the NHS can be made. Although it's not like it's a general notion, and it's based on on data that if you improve the life of people, or if you improve preventive medicine, or you put more money in social care, actually in the long term of things, it's saving money in on the NHS. But having said that, let's move on. Medical devices. One good thing about medical devices is that it enables immediate access to care. So it's with the person, it's on the person. So that the response is immediate, and it gives a kind of psychological reassurance. It reduces the risk of diagnostic errors. Now, this is because inbuilt into these devices are error checkers, which are linked to the cloud. So anytime there's a discrepancy, or anytime there's a problem, these guys or these people will flag it up and get in contact with the person who is being monitored. And they're also in contact with one another. Also, it helps patients to take ownership of their own health. So once a patient is, this increases compliance, and also means that the outcome, research has shown that once compliance is high, the prognosis is better, much, much better. It helps streamlining the clinical process. So with data coming in, you can kind of predict and create a workflow to deal with similar circumstances. So it will just be like one process moving to another step, and all these steps will be in place to deal with the person or the ailment. So, for example, if the blood sugar is high for more than two occasions or even one occasion, there's specific steps already. This is set out. You inform the patient. The patient knows it. This and this. If it's after if it is instituted those changes, if it doesn't change, there are ways in which the person can come in to see a nurse specialist at a particular time. All the data is with her. She can analyze it and also make sure that everything is okay for the patient. Then also, um, it also makes it easier to specifically deal with that patient. So therefore, the uniqueness of the patient, we can customize it, the process, once we've got it on a workflow system. So it will meet the patient or the client's own unique situation. So that's another great thing about it. Another thing I would like to discuss is AI and robotics. One thing about AI and robotics, the way things are going, uh, once it improves the accuracy because it checks and monitors um, 24 hours a day. It's a machine. So also uh, precise diagnosis, because it's attached to the cloud, it can get further information to help with the diagnosis. So it will check the history, it will check the this and that. So everything is at his fingertips. Also, um, robotics and AI allows remote treatment, as saying people are doing surgery. Um, they need not to be there. They can do remote surgical operations using various instruments. Um, then it augments the human abilities. I mentioned that there's somebody that I've been to an AI imaging seminar, which uses the software to produce 3D models from 2D models like X-ray, ultrasounds, NMR scans, CT scans. It uses it to construct a 3D model, and hence the surgeon can plan and make better judgments based on the 3D model, that maybe what they would do or how they would remove the, the injury. Then supporting medical, mental health, and daily tasks. Now, for example, things that appear to be repeated work, or things that are simple tasks, these can be done by a robot or even AI. So, and as you can see already, these companies are all using AI in their systems, and which are analyzing the data, and which makes them more efficient. It makes it faster, and also it makes things easier for everyone. Um, so in summary, I mentioned about the need for the use of tech in the NHS. Um, this is from Moneyball, so it's adapt or die, and that is what you know what I've mentioned about big data analysis. Um, I've also mentioned about the medical devices and apps, and also AI and robotics. Uh, Thank you very much. Any questions, any concerns, or any comments? Thank you very much.